Sarah Cottingham with Lexington Family Practice Forest Acres. Thank you so much for joining us this morning. All right, so first things first, I want to talk about skin cancer. I know that it's a very common form of cancer. So can you let our viewers know a little bit more about it?
Sure. So actually skin cancer, melanoma specifically, is the most common skin cancer between the ages of 25 and 29, which is kind of scary. A lot of that is tanning beds and not using your sunscreen when you're getting a tan.
That's so important to make sure that we put on that sunscreen. And speaking of sunscreen, it is literally one of the best ways to protect our skin from the sun.
It is the best way. It's that avoidance, obviously, yeah.
Yes. Okay, so how often should we be putting on sunscreen? How much should we be putting on?
So for sunscreen, you want to apply it about 15 to 30 minutes before you're going to be exposed to the sun. You want to reapply every 2 hours. If you're swimming, you want to reapply every hour.
Ooh, that's important to know. I need to start reapplying.
I know, we may not be doing it quite enough.
Okay, so one of the things I heard too, Dr. Cottingham, when it comes to how much sunscreen, I saw this on social media where you do like 2 finger links. Like, how do you know how much?
I think you just want to make sure you're getting good coverage and you're not, it doesn't need to be too thick, but also you want to make sure you're getting everything covered and even.
That's so important.
Yeah.
And you want to get every single place too. Like, we forget sometimes about our feet. Our ears, our hands.
Exactly.
All of that is extremely important.
Top of the head, and men with their, right?
Yep.
Got to be careful with all that.
Got to be careful with that. All right, so we also have a great variety of sunscreen here. One of the things that can be a little bit overwhelming is trying to figure out what is the most effective sunscreen, and how do we determine that? What factors go into that?
So there's basically 2 main types of sunscreen. There's mineral-based and chemical. And by chemical, that sounds scary, but chemicals are not bad for you. So the mineral-based is going to be a physical blocker, like zinc usually, or titanium. And you put it on, and it's going to actually start working a little quicker because you just put it on, it's there. It doesn't have to be absorbed by your skin. And it starts working right away. The other thing you want to look for is broad spectrum with both. So you can have one that's just UVA or UVB. You want something that does both, broad spectrum sunscreen. The chemical sunscreens may be a little better if you're in the water and swimming because they do need to be absorbed, so they're not going to wash off as easily. But you have to be careful there because they're more harmful to the reefs. So if you're environmentally conscious, you want to look for something that says, it's going to protect the reefs. So if you can look at, this is not a chemical, but some of them will also say it. This one says, has a little symbol and says we protect the reefs.
Perfect. So some info, I didn't even know that. Some good information there. All right, my friends. So the big takeaway here, put on your sunscreen. Yes. It's so important. And reapply. Dr. Cottingham, thank you so much for joining us this